So my name is Siddharth and today I'm here with Dr. Bharat to have a conversation.
Hello everyone, my name is Dr. Vyas. I'm a senior consultant physician and specialist in cardiology and diabetology.
I have a few questions for you. The first one being, what's the difference between type 1 and type 2 diabetes and how can someone know which one they have?
Yeah, that's a very interesting question. Type 1 diabetes is primarily an autoimmune disease. That means we have in the blood, we have red blood cells and white blood cells. The white blood cells are like soldiers. They are supposed to protect us from the invading organisms. In some people, because of the genetic reasons, these white blood cells, they go and destroy the cells of the pancreas. The pancreas is a gland which is present at this area. This pancreas is responsible for both exocrine and endocrine functions. Exocrine functions are secretion of digestive enzymes. Endocrine functions are regulating the glucose metabolism. So the endocrine part of the pancreas, especially the beta cells of Langerhans, which are responsible for the production of insulin, they get destroyed. And it happens when we are kids, especially when we are like around 5-6 years old. That's when the process starts in most of the people. And over a period of time, the pancreatic beta cells of Langerhans totally get destroyed. It happens not only because of the genetic reasons, but also because of the environmental factors. In some people, it is postulated that cow's milk can cause it. Okay, but the evidence is there, but it is not substantive. Okay, so some extraneous factors also contribute to the destruction of the beta cells of Langerhans, but mainly by genetics, by variations. Variations are inheritable, not uninheritable changes in the genetic code. When they are inherited, we call them mutations. So this, because of some variations in the genetic code, the white blood cells get programmed and they destroy the beta cells of Langerhans as kids. And these type 1 diabetes people are usually dependent on insulin. The treatment is only insulin and it happens when we are kids. Whereas type 2 diabetes happens because of the development of insulin resistance when we age. And it is purely a lifestyle related disease.
So in type 1, you mentioned that there is a way that the kids get it. Is there a way to know that your kid has it without, like, is there some signs?
Yeah,
that
especially people, for example, kids, like usually toilet training happens by the age of 4 or 5. Otherwise, if they are wetting the clothes and you find ants on the clothes which are wetted or soiled, or when they pass urine and you find ants, this is one of the very clinching things actually, which happens as kids. Other than that one, the child is having problem in growing, okay, and they are losing weight. Okay, these are the early signs of type 1 diabetes. One more thing that happens is they'll be drinking a lot of water and they'll be peeing excessively. They also become very often sick, okay, especially with urinary tract infections. So these are all the signs and symptoms which can tell us that the kid may be having type 1 diabetes. And one more thing is that type 1 diabetes is usually not inherited, whereas type 2 is 100%, most of the time it is inherited.
Okay, the next question is, what are some early warning signs of diabetes that people should never ignore? We've talked about like the one in kids, but let's say if it comes to teenagers and all, so maybe it might be different depending on like the things you mentioned earlier.
So early warning signs in kids you are asking, na? So
in teenagers.
Teenagers and adolescents. Teenagers and adolescents, usually their type 1 diabetes is already diagnosed by the time they become teenager or adolescent. But there are certain rare conditions in which type 2 and type 1, they they masquerade. That means autoimmune diabetes can develop in adolescents late in the course of the time. That is called LADA, latent autoimmune diabetes of the adults, but usually develops in adolescents, not in teenagers. There is another type of diabetes, that is MODY, that is maturity onset diabetes of the young. This is type 2 diabetes. This is not autoimmune diabetes. So these are rare conditions, not we don't usually find them in the population. So teenagers and adolescents are usually free of diabetes symptoms.
Right.
But if it happens, the symptoms are same. Usually for diabetes, one of the hallmarks of diabetes is early in the course of the disease, people gain weight. Late in the course of the disease, they lose weight. Second thing, they'll be drinking a lot of water, especially in the late stages, and peeing excessively. And most of the time, they are dehydrated when they are peeing excessively. And they'll be losing calories. So these are the hallmarks of diabetes diagnosis.
All right. Any physical, beside gaining weight and all, is there any other physical changes that you may see? Maybe like there are some white particles on the nails. Can that be counted as?
That's called leukonychia. These are subtle signs.
Okay.
Subtle signs are difficult that is mostly for the knowledge of the doctors.
Yeah.
For the general population, it is most of the time what we have to remember is polydipsia and polyuria. Polydipsia means drinking a lot of water and peeing excessively. This is one of the most important thing which will lead to the diagnosis of diabetes.
Can early diagnose save or help get rid of?
Diabetes diagnosis early is very, very important actually. In fact, most of the diabetic patients who become who develop kidney disease late in the lifespan, it happens because of the late diagnosis and controlling lately. And it is very important in type 1 people, especially the kids, because they become diabetic very early, and if it is diagnosed and managed, we can save the kidney. Otherwise, they are condemned to kidney disease for lifelong.
Right.